Boris Johnson says that he is in good spirits after spending the night in hospital with coronavirus. The Prime Minister was taken to St Thomas's Hospital in London on Sunday evening with persistent symptoms, including a temperature and a cough, for routine tests. He remains in charge of the government, although the Foreign Secretary Dominic Raab chaired today's coronavirus meeting. A short while ago, Boris Johnson wrote on Twitter, "I'm in good spirits and keeping in touch with my team as we work together to fight this virus and keep everyone safe." He also thanked the NHS staff taking care of him, saying they were the best of Britain. Scotland's First Minister, Nicola Sturgeon, has said that she came to a firm view that the country's chief medical officer should resign after they had a long conversation last night. Dr Catherine Calderwood quit after it emerged that she'd made 2 trips to her second home during the coronavirus lockdown, ignoring her own advice about avoiding unnecessary travel. The charity Refuge says that there's been a 25% increase in calls to the National Domestic Abuse Helpline since the coronavirus lockdown was introduced. There's also been a sharp rise in traffic to its website. The head of the UN has urged governments to make the prevention of violence against women a key part of their response to the pandemic. And there's continued concern that the sunny weather is encouraging people to linger for longer in parks and outside of their homes than is absolutely necessary for the purpose of exercise. Well, our first report this afternoon is from our political correspondent, Helen Catt.
This was the Prime Minister 10 days ago.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test that has come out positive.
His symptoms have not gone away. And after more than a week of self-isolating in Downing Street, with a brief appearance at the door of number 11 on Thursday, he's now under observation in London's St Thomas's Hospital. In a tweet, the Prime Minister said he went in last night on his doctor's advice for routine tests and is in good spirits.
He's been working extremely hard, leading the government and being constantly updated. That's going to continue. Obviously, today he's in hospital having the tests. But he'll continue to be kept informed as to what's happening and to be in charge of the government. And as I say, I think we all do, that he has a speedy recovery and he gets back to number 10 and can take charge in the way he would want to.
So, while the PM stays in charge, it was the Foreign Secretary Dominic Raab who chaired the government's coronavirus response meeting this morning. He will continue to do so while Boris Johnson remains in hospital. Sir Keir Starmer, who became the new Labour leader on Saturday, has wished Mr Johnson a speedy recovery, as has the new Shadow Chancellor, although she too says work goes on.
Well, obviously I am concerned that we really need to make sure that the British Parliament, the whole political system, responds correctly to this unprecedented challenge. Certainly from the economic side, I'm aware of how much so many businesses are really struggling, and individuals as well.
Downing Street has been keen to reassure people that Boris Johnson's condition hasn't worsened, it just hasn't improved. Despite the reassurances, it's clear that Boris Johnson has found it harder to shake off this virus than some others. And the Prime Minister being admitted to hospital at this time, whatever the circumstances, is likely to prove unsettling. And there is an immediate impact. Tomorrow's Cabinet meeting has been postponed, although the daily COVID-19 meeting will still take place. Helen Catt, BBC News, Westminster.
Well, we can speak now to our political correspondent, Jonathan Blake, who's at Westminster. And Jonathan, you detect lots of sympathy for Boris Johnson across Westminster, but also, I think, some concern about how the government can be run from a hospital bed?
Yes, undoubtedly questions and concern about how sustainable this situation of the Prime Minister being in hospital with what are described by Downing Street as persistent symptoms of coronavirus and still being, we're told, in charge of the government. We learned very little more from a briefing this morning about the Prime Minister's condition and the reason specifically that he was admitted to hospital, other than to say that he still has a temperature and a cough. He was able to speak to a doctor last night and the advice was that he should be taken to hospital as a precaution to undergo tests. We don't know exactly what those tests are, and we are told he had a comfortable night in hospital at St Thomas's here in central London and is in good spirits. And in fact, in the last hour or so, the Prime Minister himself has tweeted, we assume from his hospital bed, in his own words, saying that on the advice of his doctor, he went into hospital for some routine tests as he's still experiencing symptoms. And as he puts it, I'm in good spirits and keeping in touch with my team, going on to thank workers in the NHS and urging people to keep following the rules set out to slow the spread of the coronavirus. So it seems the Prime Minister is staying in hospital for the time being. Whether that will end up being another night, we'll have to wait and see. But we were told by Downing Street, as expected, that the Foreign Secretary Dominic Raab, in his capacity as First Secretary of State and effectively the Prime Minister's deputy, chaired the daily coronavirus cross-governmental meeting this morning, and it seems that the cabinet meeting will not be happening as planned tomorrow morning. Other than that, Boris Johnson is in hospital getting papers for sign-off and briefings in the ministerial red box, we're told, and remains in charge.
OK. Jonathan, many thanks. Our political correspondent Jonathan Blake there.